We're live.
I'm Senate Appropriations, January 14th, 1 month away from Valentine's Day. Not that that has any impact on politics. We're going through the Budget Adjustment Act. And first off, is Eva, so you can introduce yourselves for the record.
Good afternoon, I'm Deshaun Groves, I'm the PIVA Commissioner.
I'm Stephanie Barrett, the CFO at Viva.
Great, thanks. Want to walk through I don't know if you all want to tell us anything about Diva or just go right into your needs.
I think most judges are.
Viva is the main, Medicaid agency for the main medical claims that go through. Obviously, mental health and developmental disability.
Was it always this? Here's my question about Diva. Was it always called the Vermont Access? When did the word access get?
Oh, that happened about 20 some odd years ago when the agency was reorganized. It used to be Department of Social Welfare, was where a lot of the functions were. So that's, I want to say 2002 maybe.
Wasn't part of the whole effort to go to a single payer.
It actually predates that. Yes, it does predate that. It was the Office of Vermont Health Access within a restructure in the Department of Vermont Access.
Great.
There might even be a little bit of history in our budget book when you get it. I'm not sure. So I just start right in with our ups and downs, our budget adjustment.
Yeah.
So you have the ups and downs in your, on your website available to you. And we're going to walk through a PowerPoint that basically summarizes those points, and stop me at any time with questions. We'll start with our admin budget.
Just let you know, Stephanie, that mainly we're working on this worksheet that Pression gave us.
Okay.
So any times you can refer to like the B section, we could find it on here. But if you have your handout might be.
Okay.
Well, you
I
have
don't
on
know
the screen.
what documents these are, but I can look at
Peruse, yeah.
The finance management.
Worksheet, yeah.
Because they roll up even more. They're going to be 307 is where we start.
Okay.
No, 306. That's our admin budget. So be 306, which is one line on your large document that you work off of, but has multiple pieces in it. You're on slide 3 of our PowerPoint presentation. So there are no changes to like our staffing cost in our admin budget midway through the year. But there are changes to contract costs, contracts that we pay for that are, controlled by ADS but billed to us. And then we have some operating cost changes in our admin budget. We have a sort of a modest change related to extension of our contracts that support our chief medical officer. That's what CMO stands for. So we have one chief medical officer, Dr. Rappaport, but he does need to be able. The remit is broad, and the number of things that require a physician to look at. We have a couple of contracts that support that, and there've been updates to those contracts. And you'll see this again when you see the annualized version of this when you see the full budget ask for 27. And then there are some significant amendments to our MMIS fiscal agent contract. They're just under $2 million gross. These are matched at a 90-10 rate because they're development. So they're about $200,000 of general. Sorry, MMIS, Medicaid Management Information System. That is the big system that supports all the claims processing that we do. Gainwell is the largest share of it, but we also have a pharmacy side of that system, and some other support pieces within that system. But it's large and complex, and it's built on changes year to year.
What's with the decimal point on that? 1.99.3.
That might be a typo on my part, or the decimal point,
Yeah,
where the three is not supposed to be there.
Yeah. So it's 199.
It's, the general fund is just under $200,000,
Right.
and the gross amount is also just under $2 million.
2 million, okay.
Yes, so our share of it is that 200,000, and then the federal government share will be 1.8.
That's the 90.
Yeah. And then we also have the ADS health contracts. There's a significant adjustment here. And you will see that again as well when you see the state fiscal year 27 asked for fully annualized. And that is what's the master data warehouse and analytics solution. The funding for that project began 3 years ago, was added in the budget adjustment, and that project has gone live. That was built and developed with the one-time money that was appropriated. There's still some ongoing testing and work going on with that. But now we are moving into the portion of that contract, which is called the maintenance and operations portion. And that's beginning this month. And that's the portion that doesn't get funded with one-time money, gets funded with ongoing base money. And so the request here is an add to our base for 4 or 5 months. I think it's 4 months of invoices that we expect to get in this current fiscal year related to the contract for maintenance and operations from ADS. And then you'll see it annualized in the big bill.
Yes.
The other ADS pressure that we have is the cost of our Oracle licenses. Those were up on a 3-year renewal that support Vermont Health Connect. Those went up in late June before starting in July. And that's what you see here. You will also see that again in the budget build. And then the last piece in our admin budget is Viva will be moving to new rented space in February or very late February, early March. Those leases were signed by the administration in December.
Where are you now?
So we're in the state complex, the main building in Waterbury, and these spaces are across the street in Pilgrim Park.
Okay, so like the Department of Health is also moving to buildings.
I'm not familiar which one, but we're moving to a couple different spaces on the Pilgrim Park, a couple different spaces in Pilgrim Park. And that's what's reflected here. So because it reflects the spaces that Viva is moving into.
And whenever you have this break, this is federal state.
So it's not federal state, it's gross state. So the difference will be either federal or other special funds. We don't.
Okay.
So we give you the gross and we give you the GF, the portion of it, of total.
Okay. Yes, Senator Watson.
Recognizing that this was an administrative decision, the space that you're in, that you're moving to, I assume, is to accommodate people being in person more. And in the prior scheme where people were not in person so much, your facilities were adequate.
Yes. Okay. Yeah. Okay.
Like the move is caused by the RTM.
The return to office. Yes.
Okay. Thank you.
And then there's a couple other moves in our admin budget. One is an agency net neutral move, money coming down to pay the overhead costs that we get from ADS from the central office to us. So it's just moving from one bucket to another within the same agency. And then one that is programmatically neutral, but it's not fiscally neutral. And that is the HR1 bill that was signed federally. We're not allowed to pay Planned Parenthood with Medicare dollars for basically our state fiscal year under that. And so this budget is moving. We're continuing to pay Planned Parenthood at the same rate, but we're picking that all up on the state side. And so there's a small amount in the admin budget, and you'll see more, and there's also amount in the program budget. That is a 1-year ban on the use of Medicaid funds. But that's what you're seeing as we go through.
I saw that.
In the health department.
Yeah.
Yeah. So now we're going to move to our big budget, our program budget. And that is across, three appropriations, 307, 309, and 310 on the big sheet. And, so I've combined here across all three appropriations, for the consensus update for our base investments. That's a process that most of you have probably heard about. It's been in place for going on 20 years. The Joint Fiscal Office, the DEVA fiscal staff, the AHS fiscal staff, and Finance and Management fiscal staff come together in the late summer, early fall, and look at what the projection is for our caseload and our cost per case, because that's the basis of our budget build year to year. We're always looking at what we've actually spent and what does that portend for what we need for the current fiscal year and the coming fiscal year. And that's under the current way we operate, under the current set of rules. That's the process for building the DEVA program, the main DEVA programmatic budget. And so that $33 million that you see here is across all three. It's the global commitment budget. It's the clawback and buy-in pieces of our budget. It's the IHIP program. It's our CHIP program. And those are different sections of the budget, but we look at the whole budget in this consensus process. We forecast out the caseload. We're actually usually very good at forecasting out the caseload. The challenge is always the cost per case. We're always, we're doing this analysis is done almost 12 months in advance of when the state fiscal year turns on. So there's always a catch up mid-year, but we can continue, even though the caseload has come down, we continue to see a high cost per case. And that in part maybe utilization, there's pressure on drug prices, but it's also just the challenge of, we're a year and a half out from the unwind, but what we were forecasting a year ago probably just have the full impact of the higher cost per case folks that remain on the program and the lower cost folks that come off, you end up with a higher average cost per case. And so that dynamic's at play in this analysis that we do every year. And then we update it. We do that in the late summer and fall based on how the year end closed and the data through the end of June. And then we wait for another quarter of data to come in to see if that's indicating significant change from what we looked at 3 months ago. So we do it, September, and then we look at it again in early or mid-December. And it becomes the foundation for the motion that's adopted at the emergency court. So that we're all starting at the same position of the baseline of the DEVA Medicaid budget.
And so do you know what's causing the cost? Is it pharmaceuticals or just the acuity of the patient?
It's a combination of all three of those things, the acuity of the patient, pharmacy being a part of that, but also what we were seeing, how we understood the cost per case a year ago and the dynamic of the caseload versus what we see now. We might have got that based on, there's a portion of that in there too.
And so we have a caseload reserve, does that only use in extreme circumstances? Like when would you?
So maybe, you might want to have a conversation with this, but it is one of the reserves of the state,
right. And
reserves are one-time money. And that particular reserve has a statutory structure around it about when you can use it and what it can be used for. And so this is the underlying base budget year to year. Most of your reserves are there for the unforeseeable or like when the dynamic of the economy is changing very quickly, it's very hard for you to keep up.
Or after we've left. Or
after you've left and the year closes out in some very unexpected fashion. But it wouldn't be typical for you to use reserves to cover what you are dealing with as a base budget year to year.
And is that like the other reserves, 5%?
It's a similar dynamic of those reserves.
Is it 5% or do you?
It's 5% or I don't know if that's an automatic structure of when you're looking at your balance sheets, you see that maintaining the statutory stabilization reserve for the funds happens in that financial construct finance and management accommodates it, joint fiscal accommodates it.
Yes, there was.
Well, just a couple acronyms. I know FQHC, RHC,
Rural health.
Rural Health and MEI.
Medicare Economic Index. Sorry about that.
That's okay. I write it
What
down
is
so I
the
can look
difference
it up.
in the rural health centers and the FQHCs?
But-
Most up to this thing.
They're very similar, but they're, the FQHCs have a specific designation under
Federal
the,
designation,
and what they are entitled to, but we treat them the same.
Okay, so the rural health clinics don't have the same federal support,
See, we could treat them differently.
but they're, but as far as the Fed, they're treated differently by the feds.
Yes, they're designated differently benefits.
Sorry, MEI one more time.
Medicare Economic Index, it's the main index for the federal government related to primary care.
Okay.
And there's a requirement in FQHC funding that you keep up with it.
Okay.
We have an alternative payment method with the FQHCs, the RHCs, and we apply that methodology to the FQHCs.
Okay.
And so you will see that number annualized when you get the big bill in several weeks, when Commissioner Rose is in again.
Yeah. Okay.
After the governors. The next item, we skipped down to FQHC, but we want to go back up to adjust for coding for the applied behavioral analysis. That is a correction to how the providers are allowed to code for the services. It's a reduction, taking away the ability to best practice to code, duplicate code. And I'm going to let the commissioner explain that one a little bit more fully.
Yeah, so what we're doing is we've seen a lot of thorough scrutiny around concurrent billing within the applied behavioral analysis. And so this is us being more proactive in doing that. And so what we're saying is there are these two codes that providers can no longer bill at the same time. And so that is part of the reason why
I
you
think I had a constituent now, so it's like you can have two people.
Yeah. So the way that AMA, the American Medical Association, has defined or kind of giving guidance on this is that you can still have those two people at the same time, but it is about the patient's time, not the provider's time. And so that is what we're looking at. And under us, we bill it, our ABA benefit is a little different in other states in which we allow for a tier level. And so that we're not saying, you're not going to reduce revenue. It's just that you can't do this on a concurrent billing process and bill us at the same time on the same day.
It's the patient, but you're saying that there's other ways of doing it, whether there's
Yes.
no good company.
So this represents a half year of that change that went into effect at the beginning of the year. You'll see it annualized when you see the big bill. And then we just talked about the FQHCs. And then we have, last year, the legislature added to the budget provision in our of $850,000, assuming they could draw funding it with state funds 10% for family planning. But the way that was directed to us was not implementable. We could not implement a rate increase with a 90-10 match as expected. And so we did not do that. And we, informed joint fiscal in June that we can't match legislative intent because we can't get the 90% match for the way you've designated this. And so what you see here is us saying you gave us the money, but we can't do it. So we're taking out the money.
Okay.
And it's a full year because you gave it to us for a full year.
And
So
that work just didn't happen.
The rate increase that, and I believe it was a House initiative when they built their budget, did not happen because we could not increase and with the $85,000 of match to a $850,000 total.
Okay.
And then the other piece here, this is essentially a one-time, adjustment for 2026, the Planned Parenthood. This is the programmatic cost of us picking up the federal share that would normally have flowed to Planned Parenthood, but because of the moratorium on Planned Parenthood for the first, for 1 year, it's this $1.13 million that,
Now, how's that different than what Department of Health is picking up? It's not gonna be the same thing.
it's the same thing. It's the federal share that we're picking up. It's for what for what they are paying to Planned Parenthood, they're picking up the federal share of, they would have normally paid out a state share and a federal share. But now the state is paying out 100% of the
He
cost.
just pays different services.
Yes, yeah, there's the slate of services that health department pays for, and then there's the slate of services that we pay for in our budget. And then I have a note on the bottom of this slide, every year, January and February, we, in Viva maintain alignment with the Medicare, rate schedules. And so all those, changes that are fiscally neutral, have gone into effect. We set them to stay fiscally neutral to the state position.
Good.
So that's it for our program budget, and now we're on our one-time funding. And let's see, we're in the big finance and management sheet for one-time, but that's
So there was it for the prior thing?
Yeah, it was from the prior.
Yeah, that's not.
okay.
I apologize. So. Continuing from the line of Medicare, are you talking about with Medicare rates?
Yeah, so we different types of we have different fee schedules, and we want to make sure that they are aligned with Medicare, not the rate itself, but the structure of the way the fee schedule is built. And so there are factors in that, and we update those factors based on what the Medicare system has done. And we do that. We update those factors to stay fiscally neutral. Okay. So they're usually relatively minor changes to the rate schedule that we pay to stay fiscally neutral for our budget, but be consistent so we don't get out of alignment with the way the Medicare fee schedules are built.
Thank you.
Yeah, no, I'm glad you're asking this question.
Any other questions on the base budget?
Nope.
So, on our one-time funding asks, this is just the general fund share that we are showing here. So we have a significant 2.7 and change $1 million general fund ask for the cost of the Health Connect cloud migration. We have to stay in security compliance across that system. And so the majority of these costs are licensing costs, but this is a project that actually has started because we have a deadline by which we have to be up to date and in compliance. And that's what is reflected here. So I am not the person to go into the technical details of that, but it is work that's ongoing and that we will be getting a bill for in order to have that system remain secure and in compliance. And part of that is services, migrating to the cloud in some fashions.
It's an existing contract, or do you have to go in
I
here?
think it's several existing contracts, Oracle, Optum.
Super. Or that's just the name of their cloud.
Azure is part of Microsoft's role.
Okay. Did you have a question, Marsh, or are you just stretching?
Perfect.
And then the last one-time item is a number that is going to change. This is the number this is the Brattleboro retreat. We have a contract with them, and under the terms of the contract, the calendar year contract, we pay that we have a base amount of beds that we buy at a given rate. And then if we use more beds, we pay more in a reconciliation process. And in December, the team that tracks this was projecting a number that was at $7.9 million. In the data, there was some miscommunication on some discharge rates that were overstating the number of beds that we were over the base by. We are not, the retreat and Viva aren't seeing it. And we just started working on this on Friday last week, aren't seeing the likely number in the same way. And the teams are working on checking each other's data. We know this number is going to go down. We hope to have a final.
7.9 million is in the worksheet. Right?
The 7.9 is in the worksheet, but it is likely, we know that there's enough, you're gonna get a change to this number. We just don't know where it's gonna land yet.
And it'll be a change down.
I know it's gonna be down.
Okay, yeah. That's
That's as much as we got.
that's fine. That's,
And hopefully by the end of this week, that number will be clear.
And when we talk about beds, it's bed days or bed.
It's bed days. So, patient might have some patients have a 15-day stay, some 30, some many months. And what's complicated about this, for the people that are pure Medicaid, it's not complicated at all. We know what they cost. For the people that have other insurance, we have a lot of duals that are in the retreat. We have to understand when their benefits exhaust, especially if they've had more than one stay in a given calendar year, or if they have another payer when their benefits exhaust and what that is. That's the complicated part of understanding. For the bed days that the state had patients there under the contract, how many were over the base amount of that contract? That's what we're working through.
So you'll let us know, and then there's
You will be. And then we thought we'd give you a few updates on one-time money that you provided last year. And the first is the $10 million of stabilization fund that you provided in the budget adjustment last year, or in the budget, big goal, I guess it's in the big goal. We required a report on December 15th. That report was submitted. We, at that point, had about $3.3 million left. We have several large outstanding applications that have come in recently since the end of November for larger facilities. And so that, right now we have about $12 million of asks against $3.1 million of available revenue. We've had different classes of providers, smaller residential care providers, FQHCs, primary care practices. We have several providers that we did not award to. The standard for awarding was, severe financial distress. And so we have had a few hospitals, and just recently we've had a few designated agencies. So, but if you are interested, we can get you a copy, or your staff can get you a copy of the report from December. That's the status of the stabilization fund money that you provided last year. And then you also provided significant ACO transition bridge funding for primary care and SASH. And those, it was $10.8 million of global commitment money, and then another little over $4 million, or almost $4 million of straight general fund dollars. And those SASH dollars and the primary care $10.8 million should be going out in early February to SASH and to the primary care providers. And then the other $4 million, the first payment should be going out. That's been split into two payments in late January, early February, and then again in June. And so those are underway to get out the door. Thank you. That was the accountable care organization, One Care Vermont, which is no longer. And SASH is the program out of, it's been centralized in Cathedral Square. It's the supportive housing for folks that need that support in basically the housing agency facilities.
It's Medicare-based. A Medicare-based program allows seniors to stay at home.
Thank you. And that would pass through the One Care in the past.
I see.
And so you made the choice to utilize the global commitment fund to provide a 1-year bridge of funding. And I'm sure you are hearing from the agency on the rural health transformation grant information, but that,
Yeah, again,
that's not part of our budget adjustment. That's part of the next phase.
right. Yeah, we'll hear about that. Was there something about the rebate program and the pharmaceutical costs? I don't know, but I can't remember what it was about.
So we incorporate our projection of pharmacy costs and our rebates that we expect to come in as we go through this consensus process, and those through December are kept up.
So there's not an adjustment.
There's not an adjustment for the cost of the pharmacy services. So
And where do the rebates come from?
the rebates come from the drug manufacturers. So, you know, somebody is purchasing, a Medicaid person is purchasing a drug that is tracked and, you know, under federal law, they have to provide rebates under the structure. And we have a contractor that's part of that MMIS system that does that work for us.
Figures it all out.
It's a lag system, you know, it's usually, you know, 5 months from the time we pay for a drug and the rebate comes through. I think it's about 5 months process.
And I want to try to figure out why they would do it that way. Maybe.
It is beyond my understanding. The why is a big philosophical question.
I'll wait till I get transferred to health and welfare. Okay, any other questions? Thank you.
Holding on.
I'll go apply for, I just said the transition. They're outside. They're outside. You can just answer.
Exactly.
So, I mean,
Hard copies of what we'll be.
okay, we're on. They're kind of waiting for you to look at this. Oh, the cookies.
Oh, thank you.
Very cookies first.
That's
So I had a question for you.
Yes,
How much Tupperware do you go through here? A lot.
You get back.
I do buy Google.
You must buy all of your ingredients.
I was thinking about that yesterday.
You have like one of those giant commercial mixes.
That would be helpful.
King Arthur's happy.
Yes.
That's my favorite word flower.
Okay, so we're doing budget adjustment and judiciary, so you can introduce yourself. So if you have somebody else with you.
Yes, did you? Oh, wait, we're going to turn it so we can start.
I think it's a good issue. That
Okay, great. Terry Corso, State Party Bookstore, and he's Greg Mosley, who's our Chief of Finance and Administration at the Beneficiary. And I know we're allotted 15 minutes and we'll be within that amount of time. We really just have two items in our budget adjustment request. These are expenses that were unexpected when we submitted our budget request last year. The two items have to do with a change in the sheriff contract rate and also a pilot docket that was first explored in the fall of 2025. And Greg was going to first address the sheriff contract thing. I was going to talk about the pilot docket. And then we also have an aspect that, just for your awareness, it doesn't involve the financial impact, but we're going to just make mention of it for your results.
Yeah.
So, the sheriff contracts, we have 11 different sheriff departments under contract, not all 14. And we had built in a cost of living increase into our budget request, but we sat down to negotiate a contract and landed a little bit higher than that. So we had built in $51 an hour into our base budget, but came in at $57 an hour.
what was it?
Yeah, it was 51, we built in 54, we landed on 57. So there was an unexpected, increase in cost there of $550,000. Should be noted that when we go into these negotiations with sheriffs, we do it in unison, so we're negotiating single rate statewide. We generally try and maintain the existing level of services, the same number of deputies, same, contract arrangements. We're not trying to expand services. And so we always go in and say, what's going to keep you under contract? And fortunately, even $57 an hour that we negotiated didn't do that. Another sheriff had a retirement and couldn't fill the position. So that was the last position in the contract. So we're down to 11 out of 14. Last year we had 12.
And this is for all of our video, whether it be security in the courthouse or transport. I don't know what else.
So this is just for courthouse security. So just think of it as the roof over the courthouse and the grounds around it. The transports are something completely different. Higher with the state's attorney's and sheriff's department. So these are positions that are inside our courthouse and they'll do walk arounds in the parking lots. But, we try and have one deputy in every courthouse. In some of our larger courthouses, obviously, we have a larger number. They can range anywhere from 1 to 6 positions. In Rutland, for example, there's six deputies in there. It's a big courthouse, plus one over at the civil building as well. So 7 in the county. Some counties are very stable, and other counties are struggling to recruit.
Recruit sheriffs
Yes,
or deputies.
deputies. And we have statewide about 20 deputy positions across our 23 courthouses. We also supplement that with about 10 armed guards, private security guards. And then we have about 30 staff positions that are unarmed that also support. So we have a mixture of positions, and we have about 80 to 85 positions statewide for all of the courthouses. So the sheriffs make up about 50% of all the positions.
Pilot docket, that is the one there's only one pilot docket.
Right, this is the one that's been called the Accountability Court. It's at the Costello Courthouse in Jordanton. This was a proposal made by Governor Scott involving many different stakeholders in the fall. It was implemented in November as a 3-month pilot. It's scheduled to end the first week of February. We were asked what expenses do we have associated with that. And basically it's 3 personnel. One is a retired judge who we brought in. It involved setting up a separate courtroom above and beyond the number of courtrooms that are typically in operation at Costello. So it was a retired judge, and that's the bulk of the expense. $128,716 is the total, as well as a criminal courtroom operator and judicial assistants to operate the courtroom. And
So it wasn't really a new court. I thought it was just rescheduling those cases, but you really created a new court with a new judge.
but basically a separate courtroom
Yeah,
that was dedicated to that category of cases. So it was the retired judge, the criminal courtroom operator, and then the security officer. So the expenses that are sought is to cover those expenses for that 3-month period.
Yes, Senator Bruce.
Thank you, Jerry. I'm very interested in this pilot court. It's my home city. I'm wondering, is there talk of extending it beyond 3 months? And do you have indications thus far how it's working?
Yes, well, anytime you can dedicate more resources, and I mentioned the expenses associated with that. In addition, there was the transport aspect. That was another thing to make sure that when somebody had a hearing, they would be guaranteed transport, which doesn't happen all the time. And then also bringing providers to the courthouse so that there's more direct handoff. Senator Lyons, I know from mental health and the courts commission, that's something that's pointed to as something that would be very helpful to ensure people follow through on the services that might be part of the conditions of release or otherwise. We don't anticipate extending the separate courtroom because there are quite a bit of expenses involved. However, aspects of it definitely being carried forward, and each unit, each county is asked to also separate out that category of case and provision by plus charges to figure out what strategies would be helpful to dedicate. So in Costello, my understanding, and don't hold me to it because I know it's in kind of exploration, but my understanding is that it would be in lieu of a separate courtroom 5 days a week, 1/2 day a week. It would be using the existing criminal judgment. They would carve out that category of cases, and the providers coming in the courthouse would continue for that scheduling block. And we would utilize the same security officer. Wouldn't be an additional courtroom, would be using our existing courts, but carving out that block of time for that category of cases. That's how they're doing it in Costello. For example, in Rutland, they have, I think it's a 1/2 day every other week. They're looking at the docket that has that category of cases, how many, and then what would kind of be feasible, and what would be helpful. But having the more focused attention and getting them in more quickly has been really kind of the outcome that helps to be we hope to replicate.
And do we have any numbers of any kind?
There's a whole thing, and I'm sorry I don't have that with me, but certainly the cases have moved more quickly because there's been that focus. The other part too is a number of them diverted to treatment courts. So more of a focus and an exploration of that. And they do show success, if you will, that the cases have moved more quickly than they would have otherwise. Judge Zoney had addressed this earlier in the year before the pilot docket was proposed, and the pilot docket looked at great to be able to kind of emphasize and highlight how it is useful for that particular category case, get attention focused sooner in the hopes that you don't have the numbers adding on and to hopefully get treatment if that's COVID or, resolution of the cases, disposition of the cases sooner than what had occurred otherwise.
Yeah, it was great. Are you done?
Oh, if it turns out you can lay your hands on the numbers at any point, I'd be grateful if you could share that.
Yeah.
Okay, just send them to the committee. Because I know there were reports, and actually Judge Zoney and I just spoken briefly in judiciary. And I think that we're supposed to come and give a more formal, maybe when
I'll be in there, so
oh, that's right.
I can pick it up there and bring it in here.
Okay,
Yeah.
because I think when it finishes the first week of February is when we thought it'd be the time to do it.
Yeah, I'm just wondering. It's not over.
Okay.
That's a very short period of time.
Yeah.
Yeah.
Was that just because there wasn't money for it, so they wanted to limit the time period?
It ended up being 16 weeks total, but when it was first proposed, that was the period of time, a 3-month pilot. So we geared everything towards that timeline. And it did come, all the expenses you would know from the other, it was, there was expense involved. So I think they picked that to try it and see.
So they're studying it in other counties. You're going to see what the final numbers from this pilot. But would we see anything in the next year's budget proposal, or you can't tell us?
I think what the plan is to, again, take aspects of this, apply it in the court, see what success there is, and then if there is request. I know when Amy asked, is there any ongoing expense from the judiciary's part? We're not utilizing a retired judge.
Right. I just wondered for next year's budget, would you propose to do something that would cost
Right, well, we did say that the transports is a need now,
Yeah,
because you just have a lot more success or chance for resolution if the person's physically there.
but we could see that in the sheriff's.
Yes, yeah, I think they will be submitting additional add-ons to their BAA request associated with pilot docket for that reason, because those transport expenses are going to continue. We didn't anticipate utilizing a retired judge, so that's why both our expenses are ending now, but we're very hopeful that, again, focusing on that category, then all the units will, reap benefits.
Okay.
And then the last aspect of it, in 2 years ago, we had requested 26 positions in a variety of roles, and the legislature approved those positions along with the statute that resulted. It had us along with Department of State's attorneys and sheriffs making a similar request. So there was a total of 35 positions that were approved, and it was at the end of the session they were approved. And it was funded in the general fund, as a base budget, but we were told they were long-term limited service. It was a little unclear what
Yeah.
exactly that meant. It was suggested we consider it 5 years, but we were requesting it as permanent. It wasn't a need that would be something that would be over within 5 years. So there are those positions. Last year, Department of State sheriffs came and they were, they asked for permanent, to have them be considered permanent. And that happened, and it was suggested to come back this session and ask it, from our perspective, why it's critical. The people that were hired in those positions for extended long-term reviews, the year 2028, the closer we get now that we're in 2026, recruitment and retention, people we fear already are looking to see, okay, this is not going to last, and we have the need for that. Between judicial assistance, staging security.
They're all until 2028 limited service.
Right. There's no financial impact because it's again funded.
Right, but you have to tell them that the funding's only, positions only approved through 2020.
Well, again, because it's permanent, it was our understanding that it would be permanent, but we would come back.
Permanently limited.
So we're asking for the same treatment that state's attorneys and sheriffs received last session when their 9 positions were granted permanent status in Keeper.
Right. Well, let's
So-
talk to our HR professional.
Okay, so again, there's no monetary
Yeah.
impact, but we just wanted further to say it was suggested that we identify there's something that we're requesting.
Are these all your limited services? These 35, do you have others?
We do have others. We had some during the pandemic, using pandemic money. Those have kind of ended because of the one-time money that's been spent. And then we have a couple of federal grants that do treatment dockets. That because they're grants, they're limited service positions. Yeah, there's about maybe 5 positions in the judiciary that are limited service outside of these.
It's 26, but then this is 35 plus, oh, there's 9.
The 9 were the state's attorneys and sheriff's positions.
Right, okay. Okay. Any questions for the judiciary?
I have questions about limited service positions.
We can have a tutorial with our
I
HR
guess.
professionals.
Tutorial.
I mean, I understand the limited service, I'm just gonna ask the question. Know what that is, every time there's a limited service position, is a clock associated with that? You know what I mean, like, it's a limited service position, and this one is 2 years, and this one is 3 years, and
Yeah.
this one is 1.
Yeah.
Or some of them, they have no clock.
I think they all have.
They all have a clock. We're required to, when they give somebody a letter of hire, have an end date listed. So there's an end date on all those positions. And in some cases, for those 5 grant positions, the end date is when the grant expires. A lot of times the grant will get renewed and then we give a new letter of hire.
There are some people that are limited service for their whole career, 25 years in state service.
That sounds
It
stressful.
just gets renewed every 5 years or something.
That is correct. The problem that it has for us and of course the people in the positions considered temporary. So if they're continuing to look for permanent work, we have higher turnover rates, which impacts training them, institutional knowledge. And so it's different.
My follow-up question to that was, this idea of like a long-term limited service position, that's not a term of art, that is just something that
No,
that's just.
and this was just an unusual arrangement that, because normally we wouldn't be funded out of the general fund, that would be a permanent position. So it's almost like a hybrid. So we're asking them to kind of
There is,
clarify that.
there is more and more structure being built around it. For example, the union contracts identify that, at least the executive branch union contract identifies that when a limited service person is here for 5 years, they now have RIF rights. So it's starting to it creeps into different places.
Gotcha.
It was originally created to be used for branch work that happens.
That makes sense.
And then also from what I understand during the pandemic, limited service positions that were geared to kind of temporary situations or circumstances.
Yeah, we ended up with 56 limited service positions in the judiciary that was funded with one-time COVID. And we used that for 4 to 5 years. We now wound that down just this past year. But as we do that, our turnover rate went up over 30%. So we were able to manage it, so we didn't hit a cliff where one day we came to work and there were 50 fewer people. We kind of, ramped it down, but the turnover rate and the training that happens as a result of that is difficult for the courts to handle.
Yeah, well, we can, because this is, if you remember from last year, there was a lot of discussions about moving from limited service to permanent, just creation of positions. So maybe we can talk more about that. Well, thank you.
Thank you all.
That was helpful.
Appreciate your time.
Thank you.
Yeah, thank you. Yeah, thank you. As usual. And then we'll move right into the rural health transformation.
I think you can get one just by going in.
Yeah, I think if you.
You need a new one?
Oh, thanks, the hog. There's a little more hay here that you can stand. It doesn't, it's where they're not only sitting in my flock. Anyways, moving along.
All my stuff now.
I got it just after I bought the keypad for the old one. It doesn't fit this one.
Beautiful.
Yeah.
Right.
We can tell the north.
The charging cable.
Yeah, there you go.
No.
That's right. Slowness. Give it. Transfer.
Transfer, yeah.
It's a limited service position. I can.
Whatever it takes.
But was it planned obsolescence?
Okay, I think I did it.
Very good job.
And I didn't make feedback like I did Senator Lyons committee this morning.
Yes, we did coordinate it. I know you were doing it twice in one day.
Yes, I'm doing the roadshow now. Good afternoon. I'm Jill Mazza Olson. I am the new Medicaid and Health Systems Director for the Agency of Human Services. So in my role, Monica Ogilvy is my predecessor, and in my role, I sit in the Secretary's office. I report directly to the Secretary, and I have sort of broad responsibility for the Medicaid program and for healthcare reform. So the Director of Healthcare Reform reports to me, as does the Medicaid Policy Director. The Commissioner does not report directly to me, the Policy Director does. I may look familiar to you. I've been around for a long time in this building. I spent the last about 25 years representing providers. So this is a big change for me to be in the administration. So I spent about 14 years with the Hospital Association. And then about the last 9, representing home health and hospice. So I have a broad view on the system, but this kind of role and understanding the mechanics of state government is definitely new for me. So forgive me for the things that you may ask me that I just, some of them may just be too technical and mechanical for me yet. So, okay.
I'll just say at the beginning, the reason we wanted to have you in is
Yeah,
we're having a lot of people saying, hey, you're getting all this money, we want to use it for X or Y. So we wanted you to just like clear the record on, give us information. So when we're told, when we're get a constituent or a constituent group that says, you know,
yes,
Jill has all this money, make sure she
Yes.
sends it to my X, Y, or Z.
We already took it this morning.
Oh, yeah, I'm sure.
okay, and that helps me, and I probably spent less time on some slides than others, so I'm gonna talk about it a little bit more sort of mechanically in a way and how it works. And yes, there's nothing like being the face of a $50 billion people that are calling you. Okay, so I'm gonna actually start on just the sort of mechanics of what we're talking about here. This is a national initiative from the Centers for Medicare and Medicaid Services, passed as part of, we call it HR1, One Big Beautiful Bill, so the July 5th, 4th bill. It was part of that, and it's meant to help states modernize their rural health systems. So it focuses on things like workforce, technology, and other sort of transformations to try to change how care is delivered in communities. So it gets at ideas of affordability and access that way, but it's not direct funding for premium assistance or for rate increases. It doesn't do some of the typical things that CMS sometimes does through the Medicaid or Medicare programs. It is essentially a giant grant application. So they released what they call the Notice of Funding Opportunity on September 15th. So that is the application. We submitted our application on November 5th. So we had a very short turnaround time. And what we did in order to sort of achieve that timeline was Vermont is a place that's done a tremendous amount of healthcare reform. There's a lot of experimentation going on already, things that we're interested in that we want to scale up. And so we really worked from I would say previous work and ideas that were already on the table when we thought about what we wanted to propose. And we did propose specific initiatives. So we have proposed ideas to CMS to say, if you give us these dollars, we're going to spend it in this way under these giant headings. So the plan is already essentially proposed to them.
But in a big heading, like the details.
Pretty big buckets with sub buckets. So like an initiative is workforce, but under workforce, we actually propose specific ideas like a tuition assistance program that comes with some strings attached so that people have to stay in Vermont for 5 years if they use that funding. So there's about 40 total initiatives in 5 or 6 buckets. But the idea, I think the thing I can say is that for people who just have sort of new ideas, we've already submitted a plan to CMS.
Right. But could they have an idea that's within one of your sub?
They might have an idea that fits an RFP that we will eventually put out.
So you will be issuing some RFPs under something.
RFPs and there's some things that are going to be grants, most of the things are through grants, RFPs, few things we have to procure through, there'll be contracts where
Is that known now, or you still have more work in
lots
place?
of work left to do. Lots of work left to do. So we received the notice of the award on December 29th with just a little bit of contact with CMS in between. So they did send us a series of 4 questions. Most of them, 2 were technical. 1 was a little bit of an elaboration, and 1 they said doesn't look like to us like this is allowable at all, which was we had a workforce housing proposal, which I thought was very creative. And they said, we don't fund capital stuff. I mean, they essentially, if you go back to the grant application, they didn't think about housing at all. They did think about facilities. And on the facility side, they said you can't increase the value of the property. Like you can only do minor renovations that don't increase the value of the property. Hard to renovate housing meaningfully without. So that we actually in that little go round, we removed it from our application. We resubmitted a budget that didn't include it because they were making it clear it was not allowed. more things could change. So I'm not sure I was crisp enough about this morning, Senator Lyons, in your committee, but more things could change. We're submitting a revised budget to CMS on 30th. So we asked for $200 million, that we were supposed to ask for $200 million. We received $195 million for the first year, which is a terrific award for Vermont. And speaks to the strength of our application. The first $100 million all states were going to get. Second $100 million was based on three things. Two of which we could not control. Metrics of how rural Vermont is. And while we score highly in some ways of defining rural, we did not score high in the way that was defined in this particular application. So we couldn't change those. And then various policies that CMS prefers, and Vermont didn't score especially well on those preferred policies.
Can I ask, was the reason, part of the reason we didn't score highly, that Chittenden County was included?
No, it was more that like things like the square miles of the state mattered, like literally our number of square miles. So we're not that physically big, even though we are so much of our population is in a rural place. Numbers of rural facilities mattered. So we just don't have that many of anything. And so those kinds of things made a difference.
I see.
But you still got 195, 200.
Well, this is what I'm saying. So we didn't do super well on those metrics. We didn't do super well on the policy metrics. All that was left was the strength of our application. And so to me, the fact that we got $195 million says we actually presented a pretty strong application. And we did as well as we did really well on the content.
Senator Ruth, did you have that further?
And maybe you can address this at some point, doesn't have to be right now.
Sure.
But my understanding was that Chittenden County was not covered by this program, or it's not.
I'm going to get to this Chittenden County question.
Okay.
Yes, I will get to it. And I will not fully answer it. You will not be. Spoiler alert. Yeah. But I will partially answer it based on what I know now. So let me keep going. So some things that I think are helpful to know. We had areas of focus, and we also had sort of the known restrictions. And how we're thinking about these dollars is essentially as one-time funding. And in fact, we're only guaranteed really the first year award. We don't know what the subsequent awards will be. So we're hopeful that it's 5 years. So we're hopeful they'll be similar, but the award is 1 year at a time, and there is a re-up each time. So when we think about how we use the funding, we're really thinking about it, sort of one-time funding, how to launch things, how to start things, how to buy things.
I assume it's a reimbursement grant. You're not getting the 195 million.
No, we have a lot of work to do before they'll release dollars to us. Yes, exactly. We can't supplant the state budget. We generally can't fund otherwise billable services, although there is some nuance there for some things that are new that aren't being billed now. We may be able to actually help something start up, but it would need to then be sustained. And we generally can't fund clinician salaries. So there's a lot of like ongoing operations that are definitely not intended to be funded with these dollars. We do have, even though it's the first year award, this just came out, we got clarification this week. We do have until September 30th and 27th to spend the dollars the first year.
No.
So the first year is going to be more like 20 months, not 8. But we do have to report in on August 30th of this year, 60 days before the end of the first year. And so the whole question of how does what we've done between now and August impact our second year award is not clear. It's going to be hard to spend lots of dollars in that period of time, not just for us, for all states.
Yeah.
Let's see. Okay, now I'm getting to the Chittenden County piece. Okay. So first of all, the way they were in the scoring, all federally qualified health centers and community mental health centers, or we call DAs, counted as part of our scoring. That was just in the statute. They said it doesn't matter where they are. If you have an FQHC in a non-rural area, you can still count it. We could not count our non-rural hospital, but we could count our rural FQHC. as we understand it, everyone, there's no provider who isn't eligible to apply for RHT funds if we've put out an RFP or procurement, mostly be a grant, but it's really more RFPs. But CMS has made clear that the dollars are are designed to impact rural communities. So we have to impact rural communities. That then creates this next question of, well, what's a rural community? And that's where it's still not clear. And so far, they've been using the HRSA definition that also our Office of Rural Health tends to use. That excludes Chittenden County. But exactly what they're going to say about what we can and can't do in an RFP is not yet clear. And of course, we have providers in Chittenden County who have an impact on rural communities. So if you have a UVA medical center, take care of people from all over the state. And so that is, I think, there's going to be a lot of details that we just don't have worked out yet. And we have to follow the rules set by CMS. We don't have a choice. If we want the dollars, we have to be, we have to adhere to their rules. So lots of states are asking these questions. And this is maybe a good time to say, we're working closely with other states. So we've created a little New England consortium. So all the RHT teams in all of the New England states are meeting on a regular basis to just sort of grapple with things. It's nice because we just have sort of like close partners to say, what do you guys think about this? Or what, did you get a question like this? Or is this, and it's very comforting because this is a very new back-and-forth process. And then we have national partners who are also creating like a national information group for states that are working for essentially human services agencies. So we do have some partners as we continue to work on this. So we're going to submit our budget on January 30th. That will reflect $195 million award instead of $200 million award. Right now, our whole budget is in the other category. So they didn't assign it to the various buckets they asked us to apply for. And we don't know for sure if what will come back to us will be what we send them, or if something will come back that's different, or if there'll be a line item removal of things. All of those things could happen. Many things could happen. We just don't know. We do know that we submit January 30th and they have a month to ask us additional questions.
Senator Bruce.
I do have one more question, and maybe paranoia on my part, the federal government. Is there any chance that they might condition these funds in the last moments on, let's say, whether a state provides gender affirming care or something like that?
So it's hard for me to speak to every potential thing that could possibly happen. I will say this process feels as though it feels like they've set up a special office just for rural health transformation. The questions they've asked has been very reasonable, very thoughtful, related to our application. What they're looking for us to do in this grant is very much related to things that I think we have a lot of shared interest in, like technology and workforce. So it is moving along in a way that feels, I think, like the technical people are talking to the technical people. Is what's happening. So at this point, we are feeling very positive about this, and appreciative that there's, I think, a lot of support for rural health.
So there's not a further, at least so far, it's not contemplated that there would be further parameters laid out.
No, there really aren't. And in fact, there was in fact sort of policy scoring in effect. We've already been scored on policies, and those policies are known to us. And we've already been scored on them.
Fair enough. Thank you.
Yeah. Good question. So I'm not going to spend a whole lot of time. This is not really a programmatic committee, but this is my big overview. And I realized earlier today it still says housing because I think I made these for before we had that. We knew that was disallowed. But imagining, just to give you a flavor, this might be an opportunity to build out more mental health urgent care, more complex care in nursing facilities, dialysis and ventilators. You've got lots of people who have high acuity or get stuck in hospitals. Part of it is because there's just nowhere to discharge them, even if they're appropriate for discharge. because there's no appropriate space. There's technology, AI transcription, shared EHR for some interested providers, remote patient monitoring. Lots of work to do around our blueprint, which is our primary, it's essentially support for primary care. And a lot of workforce, I talked about a little bit earlier. So I feel like the workforce proposals are probably the ones we'll be able to get off the ground the most quickly, because they're just a little more straightforward. There's fewer partners involved, and we have more experience and built various programs.
EHR.
So yeah, so the EHR, so there's some electronic health record. I'm sorry, I'm sorry, I always forget. I speak such fluent healthcare that it is hard to remember when, yes, electronic health record.
Thank you.
Apologies. And HR means human resources, and
Oh, yeah.
AI is A1. No, it means AI. Yeah, I think that's, and then EMS, emergency medical services, I'm just looking at it. Yes, so as you, most of them I think are pretty in the. Yeah, EHR is one that actually very hard to type. All of the like word corrections don't want you to type EHR. They switch it. It's like you have to train every time you get like a new version of Word, you have to train it to. Yeah. So I'm gonna just keep going from the proposals unless people have questions about the ideas. We do have, actually, I will say here, actually, I'll get to it anyway. So we have a website. And we do have on it our actual application. So people who really want to read 70 pages, they can. Most states ended up releasing their narratives. We also have a very high level summary, and then we have, I call it the list for the list people, which is a lot of the interested parties, which is, this is just really a spreadsheet within every project and a short description of the project. So for people who want to get a little more granular without reading 70 pages, it's a really nice way to sort of, tick through and see like, oh, I see what they're getting at.
So that would be helpful maybe to share. I'm looking at it.
Yeah, those links are live on my, on mine. It's the three things I just said are those
So
three.
there's 12 pages, but they could, like, if somebody has an idea, like I have an idea X, they can look through here and see if it fit in.
If it might fit in, yes. The other thing we're doing, just to talk about communications a little bit. So we've had a lot, and this, you will get this too. We've got a lot of people who are afraid we're going to move so fast that we leave them behind. And I think there's little chance that that's going to happen. We are really working now on the sort of infrastructure that we need in place at AHS in order to make this a reality, to move from here to reality. Part of that is setting up more communication streams. So one of the things we're doing is setting up a listserv so that people can subscribe for updates about what's happening with rural health transformation. So it's not set up yet, but it will be.
Sure.
And we'll put it on the website. So people who want to know, we just released an RFP on blah, 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 will get an email at least, so they don't have to keep checking back to the website. We are planning some listening session webinars for provider groups so that they can start weighing in for us on what they might like to see in some of the RFPs, some of the things that are their ideas that they'd want to make room for. So we are going to do additional public engagement. I think we did a good job on public engagement in advance of this because we had some various work groups that already existed. We're just a healthcare reform, kind of state. So we have a lot of mechanisms for obtaining information, but I think we need a more iterative process. And I think we have a little bit more time to do that. So we won't get ahead of people. I'm definitely hearing from a lot of, not as much the provider community, but kind of the vendor community.
Yeah.
And I'm actually honestly not really taking those calls because I feel like we need to have a clean procurement process.
Yeah.
But we will have mechanisms for people to see what they might be able to apply for. Yeah. So I hope that is at least reassuring that we will.
Yeah.
We take it seriously. I think that is, oh yeah, and I think I said all these things. I maybe didn't say the range. So the state's got between 147 and 281. We're sort of the middle third.
You could apply for 200, but somebody got 281.
Yeah, so they said it, yeah, so you could, exactly. I think it was Texas. So you could, we all had to apply for 200. And then you could see they had to add up to their total to or really 100 million. It was 1 year award. And so all the awards did sort of cluster around the 200. $1 million mark, but some are below and some are above. Yeah. But for Vermont, it's, it's a high per capita and also high per rural resident. So there's various ways to look at it, but it's certainly a significant award for a state of Vermont size.
Center lines.
Is that your last slide?
Yeah.
Yeah, and then it says thank you, so that's good.
Yeah.
So I just want to say, we had, Jill Mazza Olson in this morning with, Sarah Rosenblum, who's also in charge of healthcare reform. And so there is a lot going on right now, and AHS is taking a huge step forward and leading in this area. The work that they did in putting this grant together and now having it be accepted, and then the next steps to develop the RFPs and have projects go forward. It's a huge task and it happened so quickly. When I saw the grant in November, I guess, anyway, it looked terrific. It represents a supplement to a lot of the work that's going on now, including EHR. So, some of the Act 68 work that we have started as a result of last year's legislation and previous year's legislation. This dovetails with that very nicely. It doesn't replace it in any way, but it will be a huge help. And I'm saying all this as a way of saying thank you to the work
Good work.
for Jill. This huge amount of work, and I think we all need to recognize that.
Yeah, I need to recognize the whole team of people who worked really hard to make this happen. And none of them had, they all had day jobs already. So, yeah, so everybody just jumped in.
So we do have constituents like vendor constituents.
Yes,
Should they just hold tight?
I think they should.
There isn't anybody they can talk to.
No, they're not missing anything. I think the fear that people are gonna miss it is strong. They don't need to worry. They can keep an eye on our website. We will post the subscription to our listserv, I think in the next week or two. So that people can then sign up to receive our notices and so that they'll know when we're meeting on various projects. But it's gonna be a little while before we're really ready to actually release an RFP or release do the procurement work.
And we also had representatives from Chittenden County, the FQHC. We had Bi-State Primary Care, who oversees all FQHCs, as well as Howard Center and Vermont Care Partners, our DAs and our SSAs, coming in talking about the Chittenden County question that Senator Booth asked about. So I'll let him know that there's information about that in a Q&A type event in our committee. So
There is a step you have to go to check this book, right?
Yeah, so yes, there is. I believe for the positions, I think is what we have to.
Just to accept the grant, yeah.
Yeah, so I believe that is underway and that the business office people at AHS are talking to the joint fiscal people,
Okay.
but I don't understand that process, so I'm not going to speak to it in any detail other than I know
Well, two of us are on there.
a thing has to happen and the people are trying to make it happen.
Yeah.
That's as much as I know, and to the extent you can move it along, certainly if you have influence, that would be.
I just know that because sometimes some grants, they won't, the joint fiscal committee won't meet, we'll just approve it. This is such a large grant and so many people are interested in it.
Yeah.
The committee will meet.
Yeah, I think our top priority right now is getting positions posted. We really need a project.
Yeah.
We need someone who's full-time thinking about how to take the next steps. Because right now, it's a lot of us doing it as a piece of what we do. So we really need someone. I think we put through two positions, business ops position and project director to get us going. That's not all the positions in the grant, but we need a dedicated brain.
Yeah.
Mine is divided and secretaries is even more divided. So, yeah.
Okay,
Great.
thank you.
Thank you
Yeah.
so much. I appreciate
Thank
the
you. You're
opportunity.
welcome.
I'm gonna not leave this behind like I didn't. I was healthcare the other day and then I ordered 2 more, so I have extras.
Okay, and we're back on. We're gonna continue our BA testimony. This is from I'm forgetting criminal justice council. And I don't know which one to go first, probably Christopher. Well, you know, if you can introduce yourselves and then run us through your budget adjustment requests.
Good afternoon, Chair, and thank you for the invite. For the record, my name is Christopher Burkell. I'm the Executive Director of the Vermont Criminal Justice Council. With me today is Lindsay Taverge, our Director of Administration, and Jason Pinard, our Budget Analyst. This shouldn't be complicated. Hopefully it'll be fairly simple and painless for you all. You can tell by our very abridged document, which is essentially only 2 pages, one considering our budget numbers, but the other essentially the actual language that went into our budget adjustment request, that we are essentially looking to increase $300,000 from the 1.2 that was appropriated for us to 1.5, which was actually to complete the 3 years of financial support for a 3-phase accreditation process, which included a job task analysis and curriculum development and piloting. And just for a little bit of background for the committee, we requested back in fiscal year 24, 1.4 million of an investment into law enforcement training over a 3-year period. And that plan essentially included a job task analysis, which at the time, the figure was $200,000 to complete that in the essential first step. And then the curriculum development and overhaul, which was going to be $600,000 for each of the following 2 years, for a total of what we had asked for, which was 1.4. And during that year, the governor expressed his support for almost $2 million in investments in law enforcement and victim services, but specifically to improve the training curricula and expand resources for fair and impartial policing here at the Academy. And then following the completion of the JTA, the council contracted with IATLIST, who is the International Association of Directors of Law Enforcement Standards and Training, at a cost of actually 1.5 million, which was the contract for that 3 years. The original contract estimate that we had was 1.8. We actually had to bear it down to the 1.5, which gave us the bare minimum of reaching the goal that we wanted to. But the legislature ultimately approved 1.2 million. So we have been short $300,000 to complete this contract with IATLIST. And over the last 2 budget sessions, I have requested the 300,000 in one-time funds needed to complete the work that, you know, both we and the governor identified as critical to enhancing the quality and defensibility of our law enforcement training. And we were not able to successfully argue for those one-time funds. So this is why we are before you now with the budget adjustment request to fill the gap of that final $300,000. So that's essentially the story behind it. I'm happy, or perhaps Jason or Lindsay, to answer any questions that you might have relative to that adjustment act.
Is this for all? This is just to develop the training. It's not for the training. It's like you'll have a training packet, for lack of a better word.
Correct. This is for the total overhaul of what the basic training recruit looks like and what they actually get when they come through basic training, to make sure that they're appropriately situated to go out and enforce the laws once they leave as a basic recruit. This does not include any enhanced in-service training or training beyond what basic training education is.
Okay, this is the academy, whatever that 4-month training.
Correct.
Okay, and of all law enforcement, it's all different kind. Any officer that's credentialed would go through the training.
Any law enforcement officer that's certified through the Vermont Criminal Justice Council, which is every law enforcement officer in Vermont.
Okay. And are you expecting other expenses Because like if this new training says you have to do X, but you don't have the equipment to do X, you'll have a budget request to meet the new training requirements or?
So to answer your question, we will always have hopefully some asks for future needs for our training, but this is really essentially a soup to nuts overhaul. This includes the actual curriculum, all the learning objectives, all the competencies that we're going to be testing on. It allows for us to work with IADLEST so that we're actually piloting the program, and they will come and sit in on the academy class when the curricula is completed, so that they could actually witness the delivery of the curriculum that's been overhauled and make sure that it's being delivered appropriately. It also allows for us, which, as I'm sure that most of you are aware, the majority of our training instruction staff are volunteers from out in the field in law enforcement. So this is going to be a change to them as well, that we acclimate them to what the new mode of training will be, their comfort level in delivering it, and all the documentation that they'll have to support them in doing that.
And so the kind of an open question about whether you would need new supplies and materials to meet the training, the new training requirements.
We're not going to be requesting additional funds to meet what this ask is for. Any additional training that we will be using is enhanced through other means.
Okay. Okay, that all makes sense. And when do you think this will end? This is just, I assume since you're asking in the BAA, you're assuming it'll be done by July 1st? Or no?
No, this actual contract will be completed by likely the end of year of 2027. We plan to begin piloting mid-July, I believe, in 2027. As this project has been working, they have taken all of our legacy materials that we currently teach basic recruits at the academy. That has been reviewed, vetted, reformatted, and made to be legally defensible. And then each program that they get through and complete gets sent back to us, where we have a curriculum advisory group here in Vermont that meets with IADLEST to go over what those changes are. And then we also add to that subject matter experts that look at all the things that we do that are Vermont specific, so that it might meet the defensibility test, but are we meeting things that Vermont law enforcement officers need to know that are generally specific to Vermont? So all of that gets reviewed by all of them and then goes back to IADLEST for a final review. And then we are sent each piece of curriculum as it's done for each topic of training. We're about, I would say from the last estimate that we got from the program manager, between 60 and 65% complete on that now.
But you needed an amendment now for them to finish the last part of the work, even though the whole program is going to go through 27.
That's correct.
Okay, that's pretty straightforward. And how do you always have recruits, or is it only like 2 or 3 times a year?
Well, we always have recruits. For basic training recruits, we do currently 2 classes per year. That's all that we have time and space for. We have a class that's going to be starting here in about 3 weeks with, I think I just heard the number reduced maybe from 50 to 48 this morning, that we're going to be hosting. But we typically do a class in February and then one in the fall. In between those 2 full-time basic classes, we also do level 2 trainings that are staggered throughout the year, and then all in-service training and instructor development and recertification and everything else that goes along in the calendar year.
And what's the maximum amount you could take in a basic recruit class?
I'm sorry, could you repeat the question?
How many recruits could you take in one of the basic classes? Like you said, you had 50 or 48. Could you take 80, or is it 55 is the max? What's the max?
Ideally, we would like to cap that at a number of 44, just because it allows for a better interaction between the recruits and instructional staff. Beyond that, it gets hard to manage just logistically based on the rooms, the cafeteria size that we have. We are, however, and have been for a number of years, taking whatever law enforcement will send us to meet the need that is so desperately needed in the state. So we have had classes that are much larger in size. This one started at 54. We're already down to 48 and the class hasn't started yet, which it will in 3 weeks.
Okay. Because I thought because of the difficulty we've heard about recruiting, and maybe the classes were smaller, but maybe we're on the tail end of fixing that problem with larger recruiting classes.
Yeah, we're doing everything that we can to take all the recruits that are able to be identified from agencies that desperately need them.
Yeah, okay, makes sense. Good to hear. Any other questions from the committee? Okay, well, thank you for your clear explanation and all made sense.
Thank you for your time and the invite today.
Yeah, have a good day.
Take care.
Okay, so we are gonna change gears from the budget adjustment to have a chance to speak with one of the Adjutant General candidates. So do you want to come sit up here?
will, sir. Yes, thank you.
And just introduce yourself and why you're here, and we can go around the room and introduce ourselves. Senator Watson, do you want to start?
Sure, Senator Watson, and Watson, Washington districts.
Senator Bob North, Franklin County, and the town of Elbert in Great Elk.
It's Andrew Perchlik from the Washington district.
Jenny Lyons from Chittenden Southeast.
Pat Brennan, Grand Island County.
Well, thank you, and thank you for that introduction. My name is Brigadier General retired Henry Harder. I'm the Deputy Adjutant General of the Vermont National Guard. I think you have to spell my name. Is that for clarity for the?
No.
Okay,
No,
very good.
We have it written down.
Okay. And Senator, I know I've been the deputy for a couple of years, so part of that portfolio is to be down here and testifying on behalf of General Langford. And so I think we know each other from previous testimony. I just want to thank you for your time. I think I'm the last thing between you and adjournment, so I'll try to be concise, but I want to make sure that you have an opportunity to ask me any questions you may have. Like I said, Hank Carter, I really appreciate this opportunity. I come before you today with a great passion for service. I have the same passion for service I did when I raised my right hand in 1989 to swear an oath to the Constitution of the United States, the Constitution of Vermont. A little bit of background. I come from a family of service. So my dad was a naval aviator in World War II, and two of his brothers were also aviators in World War II, and then one brother went to the surface fleet of the Navy. And definitely the greatest generation. So my grandfather on my mother's side also served during World War II. And then my grandfather on my father's side actually was in World War I. I didn't get to meet him because he died in 1964 and I was born in 1965. But he was a United States Army combat engineer on horseback in World War I. So some pretty interesting stories passing through. So family of service. I grew up, my dad, wartime pilot, and then graduated college after the war and went into business, but he kept his hand in aviation. So I was kind of interested in aviation as a young boy. By age 10, I knew exactly what I wanted to do. I wanted to serve, and if I could do it through flying, that's what I wanted to do. So I kind of had that eye and goal as I proceeded through school. As it turned out, came up here to UVM and graduated from college as a civilian pilot instructor for a couple of years. And I applied to the Vermont Air National Guard to be commissioned and go to the United States Air Force pilot training. Got lucky enough to be selected and was gone from Vermont for about 2 years of training. And then came back and enjoyed an 18-year flying career with the Vermont Air National Guard.
What did you fly?
I flew the F-16s.
The whole time?
The whole time. Yeah, yes, sir. When I was at UVM, they had the F-4s, smoky engine F-4s, and certainly was very aware of their mission and the women and men of the Green Mountain Boys and their reputation. Yeah. So flew the F-16, 4 combat deployments, and 2 with boots on the ground in Iraq. Iraq was my area of responsibility for my time. And then I diversified my career, came up through the leadership in the operations group, which is the flying mission. But then they asked me to lead our cyber operations group down at Norwich University. So Information Operations Squadron, it was called. And that's where I got to work with the Army, really for the first time, together in one area, because the Army Information Operations Battalion was at the same place. So got to know the Vermont Army Guard and work collaboratively with them at that time. That was a lot about cyber education. We did courses, mostly unclassified courses for the Pentagon, but the whole of government. So a lot of State Department and U.S. Audit Agency. And so real education for me, and then got to know the Army Guard. And then that's where we started work on being able to do state cyber defense. So when UVM had their malware attack, of some of those professionals were the ones that went to remediate that. Read here. Excuse me. Okay. And so that's then my career progressed back up to Chittenden County back again, and I went up to staff assignments up at Camp Johnson. And so I've done a few of those, back over to the fighter wing in a support role, a support commander when we were getting ready for the new mission, the F-35. And then I finished my full-time career in the Air Guard as the vice wing commander of the fighter wing as we welcomed the F-35 to Vermont as the first unit to get the F-35 and the first U.S. Air Force operational unit on the East
So
Coast.
did you get a flag from the?
I did. I get to fly those? No, they put me out to pasture by that point, flying wise. So, but I got to cheer them on from the side. I got to sit in the simulator a little bit. But yeah, no, it's but obviously very capable and very busy mission now. So just spending time doing that just to show a little bit of the diversity of my career. And then General Knight asked me to be his assistant adjutant general air in 2020. So that's the one-star general on the air side and also commander of the Air Guard. You're a primary advisor to the adjutant general, but you're working at Camp Johnson with the Army in a joint.
Did you get elected in 2019?
He got elected in 2019. Yes, sir. So I did that as a traditional guardsman, and then in late 2023, he asked me to be his deputy. Ken Gregg, who you may remember, it's a full-time state position, so you don't have to be currently serving in the deputy role. So Ken was a retired chief master sergeant, and when he was getting ready to retire, I applied for that position. So for the last 2 years, I've been the deputy. So just a little bit so you know my background. What distinguishes me and makes me uniquely qualified for this position is the breadth of my career. I had a question from a legislator I called the other day, and I really appreciate it. She cut right to the point. What distinguishes you from your opponent? And I kind of gave a C+ answer. You could tell I'm kind of wordy, but I should have just said experience, and then see what that really is the discriminator in the breadth of my career. Working with Major General Knight, I've been at headquarters for the flood response in 23, 24, the pandemic. That was the longest state of emergency in the history of the world. Real point of pride. And I will say, as a career guardsman, helping our fellow Vermonters is the most rewarding. Unlike many rewarding missions, that is the most when we can come out and help in a supporting role our fellow Vermonters. Got a lot to do with that and a lot of challenging times, but I think we responded pretty well. As you all know, the Guard has had also short notice deployments, particularly the Air Guard. So this is
Are they still deployed?
they are, yeah, and we don't know exactly when they're going to come back. We know obviously that there's been all over the press. I'm allowed to say they're in the Southern Command region, but
We don't know.
probably the worst kept secret around
Yeah,
where
yeah.
they actually are.
Yeah, there's not a lot of bases.
No, sir. But we hope to get them home. So yeah, absolutely. And and also I just want to say, and I think you all know this, but you all have your Guard is the best in the nation, the Army Guard and the Air Guard. We're little old Vermont. We punch above our weight class, but the main formation of the Army Guard, so the 86th Infantry Brigade team is the battalion is ICBT that I'm still trying to get through a lot here. So Infantry Brigade Combat Team. Thank you. But they were known as the best in the business. So we have the Mount Warfare School in Jericho. As the deputy, I've gotten to know this body and all the professionals in this citizen legislators in this state house, and it's really been instructive to me. And I think I said it, I meant to say thank you to you all for what you do, because I don't think a lot of Vermonters really know. I think there's a smaller percentage that stay very in tune with what you all are doing, but a lot don't know how much work, and they see the headlines and they can have their opinion on what comes out, but I don't think they see what all the work goes to. So what will be my priorities if I get elected to the adjutant position? A lot of them nest with what General Light's priorities have been. Strength. What do I mean by strength? We still have vacancies. So that's an area we've been working with the state and would like to, and I'd like to continue. Workforce development. We've got about 500 vacancies, mostly our traditional guardsmen, part-time in the Army Guard. And then we've got about 100 in the Air Guard.
And how does that compare to the last 5 or 10 years? Is that about where we've been? Or?
Well, for the last 10 years, we've had a challenge. Really 2008 was one of our best recruiting years. And as you know, we were in an economic downturn in the United States. And typically that's when the military become more attractive to certain folks. And so it's, we're in a challenging environment. We have low population density. We're not like the New Hampshire Guard near major center like Boston.
Yeah.
So there's some challenges, but our retention rates are great. Once somebody joins us, once a soldier or airman join us, they generally are pleased with the jobs they're doing and the culture of the Vermont Guard. And we work hard to keep that going. But we need help with recruiting. And so that's one area I'd like to work collaboratively with this body. Readiness, state readiness, and federal readiness. Always a priority for an adjutant general. Our soldiers and airmen need to be ready. The Air Guard got an 11-day notice before the holidays to go out the door. So it's my job, amongst with the rest of the sporting commanders, to make sure that our women and men have exactly what they need and they have the opportunity to train and be ready so that we can get them back safely. And that federal readiness helps us with our state readiness. So if we have the equipment and the people that are trained, they can respond to a whole assortment of potential state emergencies. Resilience, and I'll just say resilience is what we all kind of have to work on, I think, in these days. It's a 24/7 news cycle. We have these phones and tablets that help us stay connected. But you can't go home anymore. And if somebody needs you at work, they just have to call the landline. So I think we're all have to manage that. And so we have to help our soldiers and airmen manage that. And that's a challenge, and I want to address that. And then finally, and certainly, last but certainly not least, and probably rises to the top, is respect. Respect for each other 100% of the time, all the time. What does that mean? Zero tolerance for sexual harassment, sexual assault, hostile work environment, and any kind of discrimination. General Light's done a very good job with that. I tend to keep that going, and we have some really, really great professionals that, and I'm going to email in the next few days our whole curriculum. You do ultimate frisbee, right?
I
Yeah.
do.
Okay, we'll talk about that. My son is the captain of the Middlebury Ultimate Frisbee. Yeah.
Oh my gosh.
He lost the Nationals for Lewis.
Pranksters?
Pranksters.
Yes.
Yes. So
Yeah, I have more to talk about.
yeah. Okay. Have I earned your vote through that?
Oh.
Yeah.
Thank you.
Yeah, that was hard to mention that.
So I know that was a lot, and I really, I look forward to seeing you all either again or individually. But and Sharon, I don't know if you have more time for questions, but
Yeah, looks like us.
Okay.
Thank you for coming at us.
Yes, thank you for the invite. Yeah, and I look forward to maybe sitting with you
Yeah.
in the future.
Yeah, Senator Brent.
Just one quick one.
Yeah.
When and if you're selected, who picks your deputy? You?
I do, yes, sir. Actually, it's a good question. General Knight, and I will do the same. It can be a direct selection, so he can bring people in and he or she can direct who they want. What General Knight chose to do when I was selected is he kind of put it out to people that would be qualified. And they had a hiring board with him and some of the other senior leaders. So I had to go in and interview, and I think that's a good process. Yeah.
I'll just ask if you could comment on trying to recruit women in particular, because I had a couple constituents that joined but didn't stay.
But did not
They
stay.
didn't have a good experience.
Okay,
But it was in basic training of the state, so it wasn't really an experience here in Vermont. But I thought Knight did a good job of responding to that.
oh, absolutely, sir.
So I
And
don't know
that,
if there's you know, like, you've already mentioned it, so I appreciate that, but I didn't know if you have anything, so like, what strategies to get them to feel comfortable, whether it be women or other people, non-traditional people that would maybe not normally join.
Sure, that's a great question, and I will say, once again, you know, demographics and data, that's what they are, and they sometimes can be instructive, but our Vermont National Guard, Army and Air, have a higher level of diversity than the Vermont populations, and that's gender diversity and ethnic and other categories. I will tell you, the Air Guard right now, because they were the right people, the right time, have more women in leadership positions than we've probably ever had. So the state command chief, the senior enlisted person is Chief Master Sergeant Jillian Rolla, and she joined from the Connecticut Guard as an F-16 crew chief. She had worked on A-10s down there. She's had a great career. I've got the privilege of working with her. One reason I became retired, knowing I still was going to run for this seat, is I wanted to make room. There's only 2 general officer positions. So Brigadier General Laura Caputo was promoted just recently. So she's the second female general ever in the Air Guard, and Martha Ranville was the first speaking first ag nation. But to answer your question, we always have to be just general outreach. But I would say, you know, we'd have to do a better job of marketing ourselves. It's instructive to me to hear when somebody has a bad experience, and you know, if it happened in basic training, we have a vehicle and a voice to go to the training command and say, hey, we had 2 airmen come back and they didn't have a good experience. And did they serve for their enlistment and then get
There's
out?
only one that actually went to basic training, just it was a sexual harassment.
Oh, really?
He kind of fell, and I don't know the whole story.
Sure.
But I thought, you know, General Knight responded very well when I called him about it, and he couldn't tell me the whole story because it was confidential.
Right.
She kind of wanted the guard to come and get her and get her out of
Get it out of there. Okay. Wow.
Couldn't
Okay.
really explain why
Okay.
he couldn't do that at the time.
Right.
The whole situation.
Okay.
But I think having women in those leadership roles helps, maybe getting them out there more is a strategy. So women know that there's there. And
Yeah, and if you have the opportunity, we have legislator days. We usually do 2 a year, sometimes one at the Army base and one at the air wing. And obviously we've got air armories spread across the state. But you know, when you come to the base and you get one of the things at the end of the tour is you get to have lunch with airmen. And one of the best things I ever did was meet with airmen every Sunday morning of drill. We call it 45 minutes with a general officer, a bad name really, because it was really mixing with airmen. It was really hopefully more beneficial for us. But the last time I did it in my prior role, I had 5 young women lined up, and there's usually 10 to 12 folks from one particular unit. And every single one of them, the reason why they joined was the Vermont National Guard Tuition Benefits Program. So thank you all for that. But it's just always really it pumps you up when you see these young faces. They're so excited about what they were doing, and they were across different fields, medical. Some were over in maintenance. And so I think, you know, if you come visit us, and they're doing the knight in the Army side. And General Knight was very passionate. He opened up the combat arms to women earlier than other Guard units did, and said, hey, if you're qualified and you want to be, you know, that battalion commander, you know, put your hat in the ring. So I think we're doing okay. We go into better. I don't have all the answers, but we do have a lot of women in leadership positions that will help us.
Good. Thank you. Okay, no. Well, thank you, General. Thank you for coming in, and thank you for your service and for stepping up for this possible new.
Appreciate that. I hope I can earn your vote. I will, you know, hijack you in the cafeteria and spend some more time with you. Hopefully, I do have one question for you, sir.
Yeah.
You were in the Peace Corps.
Yes.
Where can I ask you?
Panama.
In Panama. I was in Panama with F-16s on a counter drug. We weren't blowing anything up. We were working with law enforcement, covertly coming up with suspected drug planes and getting their tail numbers and then giving those to
Before Noriega or after?
before Noriega. So actually, I'm sorry. No, I'm sorry. After, because this was in the mid-90s. So after the
Yeah, I was there in the 93 and 95.
Okay.
Remember there? It's been
we probably were.
Yeah.
So I know I got 2 subjects: ultimate frisbee and
Yeah.
but thank you very much.
Yeah.
Appreciate your time.
Thank you.
Oh, do we have some